I have such respect for what you're doing. My gosh.
Look like something right out of ET. Remember that show?
I do remember that show.
What prompted you to go to New York?
Well, obviously, in the medical field, it's been a calling for, many years. I mean, medicine is a calling. So I, it just, I felt the need to come here. The health, was getting bad, and we were just getting lots and lots and just lots of patients. So they're transferring in or coming in. So yeah.
Tawnya, why did you choose that particular hospital? You're at Mount Sinai, right?
Yes, one of them. There's several locations here, but I went through it was like a disaster agency that this was the one that they're working with. So.
Got it. That's what I kind of thought.
Are folks volunteering from all over the country there?
Absolutely. Yeah, we have several from Florida. We had, let me think, some Georgia, Oregon, Washington State. Yeah, they're just all over.
We know that it's severe. It's a hotspot in New York, but what if Texas needed you today?
I had thought about, first and foremost, I checked with some of the people there in Bryan College Station, and before I committed to come here, because I wanted to make sure that I would be available there. And so I was told that the peak that's going to be down there was going to be a little bit further down the road, which is when I would likely be needed. So I decided to come here, and by the time I get finished with at least a couple of weeks or maybe 3 weeks here, obviously would need to self-quarantine for a little bit, and by the time the peak gets down there, then I'd be able to assist there as well.
Tawnya, do you see different guidelines for New York than what we were dealing with here in Texas, or are they the same?
I think that as far as treatment guidelines, are you talking about?
Or just any guidelines, policies, procedures? You know how the hospital, I mean, we both live and we both work in hospital settings. Do you find that any differences in the clinic setting and the clinical setting here in Texas versus New York, because it is
well, since it's disaster, it's different. Now, I did typically, since my license is in Texas, I would have to go through a different process to practice in another state. However, since they have enacted it being a national disaster, I did not have to go through those steps, nor do most licensed professionals, in order to help. And since it was declared, we were allowed to practice under our license from our other state.
Interesting. I didn't realize that.
In terms of time, what is the typical shift like?
We are doing 12-hour shifts. However, we have to be flexible in that sometimes it may be a little bit longer than that, and it could be it could be a little bit more than that. It could be 16 hours actually. So, but for the most part, it's been a little over 12 hours a shift. So, and we're expected to do five shifts a week.
With the influx of the COVID patients, are you finding that patients that are non-COVID are getting care as well, like a diabetic or a heart attack patient? Or
yes. So the floor that we are currently, so we had to help open multiple floors here that had previously been decommissioned, just because they need the space. They were in the process of moving to a smaller hospital that they had already, I guess, built, and so they were closing these floors. So because of the influx, high number of patients, they both positive and not COVID positive, we had to open 4 more floors.
What is a typical way that you protect yourself when you're going on the floor, and then when you're coming off the floor in terms of removing your equipment?
So the clothing that we come in, we change scrubs when we get here that our hospital provided, and then we obviously put on. I have on 2 masks. I have on a N95 mask, and then I have a regular surgical mask covering that one. In addition to that, I have a face shield on, and I'm also going to, when I have patient contact, obviously that's part of the PPE, but I leave the mask on all day. I'm going to do a nasal swab on the patient here shortly. Of course, I'm going to put a gown and gloves and a little bit more than just if I weren't doing patient care. I lived when I had completed my task, and when we are going to leave at the end of the shift, we take off the first layer of mask and the shield, but we continue to wear a mask even leaving, not the same mask, but a mask at all times. We changed the scrubs back into different scrubs that we arrived with, and the bus takes us back to our hotel.
Are you tested regularly, not only for the virus, but perhaps serology tests for antibodies?
Myself or patient?
Yourself, the staff.
I have not tested yet. I probably would not at this moment. I just got here. I got here Friday, and not symptomatic. So at this moment, I would not do so unless maybe more symptomatic.
Do you feel like y'all have enough?
Possibly will do the serology later, but not immediately.
Do you feel like you have the PPE that you need?
Absolutely.
Good. So that's finally caught up.
Yes.
Oh, thank God.
There's a lot of publicity in terms of the media that healthcare workers and grocery store workers and mail folks should be getting bonuses. You know, we in the healthcare business feel like it's our calling to do what we're doing. How do the folks there feel about it?
You know, surprisingly, I haven't really heard a whole lot about that as far as people complaining that they need that, because, you know, I've seen all of our people have had it here. The only thing I've noticed, for instance, is when I went to Central Park a couple of times since I've been here, and I was surprised at the number of people that actually weren't wearing masks.
Really?
And so I did note that this morning, the governor here is mandating a mandatory mask wearing for most people. So,
do you think, from the healthcare perspective, the doctors, the nurses, all the allied health professionals, do you folks feel that politics is helping with delivery of care, or is interfering with delivery of care?
I haven't noticed it either way, because I don't have time to.
That's fair.
That's a valid.
That's fair. Are we seeing medical and nursing students being called in to help as well?
Yes, there's, you know, a lot of people that typically wouldn't have been here or having to make adjustments, or if they had previously worked in a different part of the hospital, are now working at you know, ICU and different other kind of jobs that you're having to do because you know, there was nobody to fill it at that time. Now we do have a lot more people coming in, and we are providing relief to some of the people in the fact that can take a few days off, as between their shifts and such. But yeah.
What do you see that the patients are presenting with there? Are they coming through, obviously through the ED probably?
Well, they have that, and then they're coming from outside agencies, like if they're from a different hospital versus if being, a nursing home or other kind of facilities such as that. But we're doing a lot of the overflow, and we're doing ER.
What are the primary presenting symptoms?
Well, a lot of them, it's actually, what we're finding is it's the fever, the fever, and they have to, we do chest x-rays, and we find that it's starting to look like a pneumonia though. So we have the fever and the pneumonia aspect of it. But it only sometimes they're doing the x-ray, even though they're asymptomatic. It's almost, we're preemptively checking. I'm not in the ER, so we're up on one of the other floors, like one of the medical floors.
Is there a typical demographic?
I'm not sure how they're presenting there, but they're not. They're all presenting in different complaints. So but we're finding that in the process of that, then they spike the temperature, and so then we test.
Is there a typical demographic in terms of age and weight and gender and ethnicity that you're seeing?
Well, I've seen more of the older population currently. Those are the ones that I've seen mostly, are the older.
Do you see that there are certain the risk factors on the patients that are at higher risk? Are you seeing the correlation with, for example, diabetes and respiratory underlying conditions?
Absolutely.
Yeah.
Absolutely. They more comorbidities that they have, we're seeing that put them at higher risk than they do have most of the time. So.
There's a lot of discussion across healthcare centers across the country in terms of how treatment should be handled with patients. Are you seeing azithromycin and hydrochloroquine being used there?
Yes. We're also doing the prophylactic with anticoagulants and stuff, because there have been the findings that some of the patients were discharged and they end up with a lot of clotting. So we've preemptively been doing prophylactic.
Wow.
For that.
If you had time, and you don't, you're taking care of patients morning, noon, and night, but if you were in pharmacies, you would see that zinc and vitamin C are non-existent on the shelves.
That's true. That's true.
Are people using that in the hospital as well?
We have seen that they're doing a lot of the vitamin, the zinc, and the other treatments we were mentioning, yes.
How do you make a decision about when a patient tests positive for COVID-19, whether they should be hospitalized or sent home?
Well, it depends on all the comorbidities. If they're not going to be able to take care of themselves, so until they're more stabilized, then we can send them home. But until then, they have to stay home.
Are you seeing a flattening of the curve up there?
No, I can't say that I see that. No.
Yeah, it's still the same amount.
Is part of that the reason why there may not be a flattening of the curve is what you said in an earlier part of this conversation, that a number of folks just aren't sheltering in place and aren't wearing face masks? Do you think that's part of the issue?
Well, I think that adds to it, yeah. But yeah, it's just patients that are here that aren't COVID positive. It's almost the fact that, well, they're not COVID positive yet, but they probably will be before they too long.
Yeah.
So,
are you seeing readmissions?
They're asymptomatic, it's easy to spread it that way. If you don't know you're sick, so yeah, you're still spreading it.
Tawnya, do you see the readmissions of a patient that is COVID positive and gets discharged and coming back? Are you seeing any of that?
Sometimes we have, simply as we talked about with a lot of the clotting and just other subsequent issues.
Okay.
Yeah.
In terms of risk management, have you folks been directed in terms of what the likelihood is that you will come down with COVID-19, that the healthcare workers will get the disease? And if so, have any healthcare workers gotten it so far?
Not that I'm aware of, not in my group. But, we're trying to make sure we're wearing our mask and keeping our protective gear on. Making sure we eat, drink, rest. And
there's a great deal of controversy regarding attributing COVID-19 death with the actual mortality of the disease, that in some cases it's being mixed with other comorbidities. I know that you're on the clinical lines and your job is to save lives and to deal with that every day and not to look past that. But do you get a sense that in terms of the healthcare delivery system, we're doing a good job in terms of labeling appropriately patients who are unfortunately are passing with COVID-19 versus some other comorbidity?
Well, it would be hard for me to answer that, but I imagine it's difficult to rule that out, other than if they already have so let me clarify, if they are COVID positive and they pass, your question was?
If someone passes passes in the hospital today, and they also happen to be COVID-19 positive, is it automatic that their death certificate will say they died of COVID-19? Or are we careful that we say, no, they probably died of diabetes, or they probably...
No, I think if they have the positive test, then that's going to be likely the cause of death is going to be placed on that. But I don't make that decision, but I'm pretty certain that's what it's going to be.
So you're pretty sure if a patient who passes is positive for COVID-19, that's what's going to be the cause of death?
Correct. That in my opinion, is what's going to be listed on their death certificate. Yeah.
The United States Navy, as you know, have two medical ships. One of them is right off your coast in New York, the Comfort. What determines whether a patient stays on land in one of the hospitals versus is shipped over to the U.S. Navy ship Comfort?
I don't know those. I don't know that answer.
But you're not involved in terms of saying, to your knowledge, the docs and the nurses don't say this patient should stay here or this patient should go to the Comfort.
No, I don't make that decision. I'm just, providing the care here on this floor. I don't know beyond that.
Fair enough, Tawnya. We so appreciate what you're doing. Do you feel like the media is reflecting accurately what's going on there?
Yes.
Can you elaborate?
Well, it's hard for people to really grasp what's going on unless you're here. There's a lot of patients that have it, and there are a lot of patients that have died from it. That just.
Are we seeing deaths from the flu, from the regular flu that we have every year? Are we seeing deaths from the flu equaling the amount of deaths of COVID-19 in your facilities these days? Is it relatively close or not?
I don't have the numbers in front of me, so I can't really say, but it's it's obviously a lot more dangerous because it was just, it's novel, and we, had a lot of of stuff that we just didn't know about it, and so I think it makes it it just makes it worse because.
What can you say? What can you say that's comforting? That's comforting for patients who don't have COVID-19, but have heart disease or are being treated with cancer treatments, or have diabetes or have asthma, and need to be seen regularly by either their physician or need appointments in hospitals. And the fear is that they're being delayed to the point where the risk is being placed on these patients. Are you seeing a good balance of being given to patients who have other diseases other than COVID-19?
Oh, correct. Because the floor that I'm on, we're seeing those that are currently negative, that still need their medical treatment to be in a hospital, but we're still providing the care. But obviously, there's a huge concern because there's a lot of patients that are positive. So
Tawnya, with that being said, a nurse to a nurse, are you treating all patients as if they do have it? In the form of, will you wear a mask?
Pretty much, yeah. I mean, we wear our masks regardless.
Right.
So.
Are we seeing any opportunity of you coming home in the near future?
Yes, I'll probably be here 2 to 3, maybe 4 weeks, and then I'll probably be back.
We need you to now to take off your clinical hat and put on your preventive medicine hat. And what kind of advice can you give to folks who are listening, young and old, in terms of taking care of themselves and sheltering in place?
Yes, absolutely. Stay home. Wash your hands. Wash your hands, and wash your hands. Stay home, wear your mask. You have to get out, but stay home.
We've done a piece on, as you know, and you're a frequent listener on Xpress with Doc X and Audra RN and Doc X's and Audra RN's Funny Feelings. And we've just done a piece on touching our face. And there have been several studies, one done with medical students, that showed on average we touch our face regularly about 23 times an hour. And given the fact that there's a lot of innervation in our face that's parasympathetic and calming, we rub our eyes when we're sad because it calms us and slows our heart down. How do you, as a healthcare professional, how do we realistically tell people not to touch their face when it's something that they regularly do and it's something that can be comforting to them?
Well, if you feel the need that you have to do it, make sure that you have very clean hands. Hand sanitizer, I guess, if you have to. Yeah.
Well, last question, or last couple questions. When you do come home, you have a wonderful family, and I'm sure that your concerns are not just for patients, but your family as well. Will you have to quarantine yourself when you come home?
Yes, I plan on a 2-week quarantine. Yes.
So you'll pretty much separate yourself from family and friends for a couple of weeks.
Correct.
I've got one last question. I don't know if Audra does or not, but we often talk about, in healthcare, we talk about post-traumatic stress syndrome as it relates to our men and women in uniform coming back from theater. And we talk about it certainly in terms of accidents and in relationships to drug overdose. Do you think we're going to be seeing post-traumatic syndrome occurring also with patients and family members who are associated with COVID-19?
Oh, absolutely. It's quite stressful, and there's just a whole lot of stuff that's going on with it. There's just so many patients that you have to take care of for long hours. It's not so much that it's physically draining as it is, mentally exhausting.
I can see that. Tawnya, if you could tell the viewers one thing, one sentence that you would want to be repeated and repeated and repeated, what would it be?
Well, I kind of mentioned it before. Wash your hands.
Isn't it crazy that we're having to teach people to do that?
Oh, and that's crazy.
Do you think we're at a time where there's a wake-up call in terms of understanding the importance of family?
I think that we are. People are now able to slow down and pay attention to more with family and those kind of activities, because you have nothing else to distract you from. So.
Well, I feel guilty not letting you go back to patients and taking care of them. I can't tell you from my side how absolutely delighted that you came on and sacrificing your time in New York. We love having you on the air with us when you're here in Texas. We miss you a lot, and we certainly worry about you. Absolutely.
Just know we're going to be praying for you, Tawnya, and all the colleagues and all the patients, and just to get through this. We just appreciate what you're doing. You are what they say is a hero by doing all this.
God bless you.
Thank you.
God bless you, and we miss you, and come home soon and come home safe.
Thank you.
Thank you.
Bye, Tawnya.